In this study, both arm pressures and both ankle pressures are taken at the same time for rapid results, an ABI in 5 minutes or less. Calibrated pulse volume recording waveforms are provided for diagnosis and documentation. CPVR utilizes the air-filled cuffs to generate bilateral ankle waveforms. This established procedure is faster and easier than obtaining Doppler waveforms. If selected in options, toe pressures and toe waveforms can be taken as well. From the main Revo screen, touch Start, touch Studies, and then touch Quick ABI with PVR. Enter patient information and touch Accept. Apply all blood pressure cuffs and attach the pneumatic tubes. Take extra care in wrapping the ankle cuffs to the same degree of tightness. To obtain the right and left brachial pressures, apply the PPG clips and sensors to the patient's right and left hands. The thumb, index, or middle fingers can be used. Be careful of orientation. The probes are clearly marked and color-coded. Right is yellow, green is left. Do take care to ensure that the sensors are completely covered by the skin on the pad of the digit. Allow a few moments for the waveforms to become regular and consistent. Touch inflate. Both arm cuffs will inflate to 175 millimeters of mercury. You should see the waveforms become flat. However, if the waveform persists, touch and hold inflate until the waveform becomes a flat line. Do not exceed 250 millimeters of mercury. Touch deflate. Both waveforms will soon return with regular, consistent waveform. If one side returns earlier, it is possible to touch that waveform box to freeze it while waiting for the other. When both sides have returned, touch capture. Using the left and right scroll buttons, move the first beat to the very right-hand margin of each waveform box. Touch the side button to scroll each side independently if necessary. The brachial pressures are displayed. Touch Accept. Touch Inflate to obtain the ankle CPVR waveforms. Both ankle cuffs will inflate to 65 millimeters plus or minus 3 millimeters of mercury. Let the waveforms normalize and the baseline become stable. Ask your patient to be very still. Touch Capture to freeze the waveforms. If the cuffs are not wrapped in similar fashion, you will get a warning signal on the affected side. While the system will allow you to capture these waveforms and move on with the exam, it is good practice to adjust the cuff wrap on the affected side. This will provide a more diagnostically correct, calibrated PVR waveform. Touch Capture, touch Do-Over, and touch Do-Over on the affected side. And touch Inflate. When the waveform becomes regular and consistent, touch Capture. Scroll to find the best waveforms and touch Accept. Move both PPG clips and sensors to the great toes. If the great toe is missing, the second toe is acceptable. When you see regular and consistent waveforms in each waveform box, touch Inflate. Both cuffs will inflate to 165 millimeters of mercury. If waveforms persist when the pumps stop, touch and hold Inflate. Do not exceed 250 millimeters of mercury. Some patients will have incompressible arteries, meaning that you will be unable to stop blood flow even with the maximum inflation of 250 millimeters of mercury. In these cases, touch Capture. Then set Output. This allows you to type in CNO for Could Not Occlude. Touch Deflate. Allow both waveforms to reappear and touch Capture. You may capture a waveform independently by simply touching the black part of the waveform box on that side. Scroll the first beat back to the right-hand margin on both sides. You may need to use the side button to scroll right and left independently. Touch Accept. If previously selected, Revo may prompt you to establish great toe waveforms and pressures. If so, wrap the digit blood pressure cuffs around the base of the great toe. Connect the digit cuffs to the right and left ankle pneumatic tubes. If removed, apply the PPG clips and sensors, being careful to place the sensor on the pad of the great toe, centering the sensor so that they are touching the skin. You will see waveforms from both great toes on screen. You can adjust the baseline if you wish. The side button allows you to adjust these parameters independently. Touch Capture to freeze the waveform. If necessary, use the right and left scroll buttons to center the best waveforms. You may scroll right or left independently with the side button if you wish. Touch Accept to continue to pressures. Allow a few moments for the waveform to become regular and consistent. Touch Inflate. These small cuffs quickly reach maximum inflation. You will see the waveforms become flat. As before, touch and hold Inflate if waveforms persist. Touch Deflate. Wait for both waveforms to return with regular, consistent waveforms. If one side returns earlier, it is possible to touch that waveform box to freeze it while waiting for the other. When both sides have returned, touch Capture. Using the left and right scroll buttons, move the first beat to the very right-hand margin of each waveform box. Due to disease, the great toes may have different pressures. If so, touch the side button to scroll each side independently. Touch Accept and print.